analysts this hour, India has achieved a big landmark in its COVID vaccine drive after 200 crore or 2 billion doses of vaccine were administered today. Now, this is in 18 months since India began its vaccination drive against COVID. Now, to give a push to this vaccination drive this week, the Union Health Ministry has launched a 75-day vaccination drive to administer precaution doses free of cost for people aged 18 and above. All right, in order to speak about what this means, I'm being joined by Dr NN Mathur, former director at the Lady Hardinge Hospital. Sir, thank you so much for joining us here this evening on Mirror Now. No doubt this is a huge achievement for India. So, can we say that it is because of, these large-scale vaccinations that we're seeing in the country, we've been able to restrict hospitalizations, we've been able to restrict death, and to a large extent, even another wave?
Yes, this can be interpreted like that. However, we should be also familiar with the fact that the third wave was because of the Omicron, and which was rather a mild disease. And therefore, both the factors have played, the mild disease as well as the vaccination.
Right. Dr. Mathur, I request you to stay on with us. We're also being joined by Dr. Jayalal, the former national president of the IMA. Sir, thank you so much for joining us. I'd like to take, the same question with you. This is what I was asking Dr. NN Mathur, that the fact that our vaccination numbers are, so brilliant, we've been able to achieve them in such a short span. Can we, in a way, is it safe to say that these vaccination numbers are the reason why today we're not seeing many deaths? We've restricted the hospitalization numbers and perhaps even another wave?
Absolutely, it is true, because it is only because of the vaccination what we had that very disastrous effect on the second wave, which we were not seen on the subsequent third wave or even now on the fourth wave. And the people were that what we are now getting only the upper respiratory tract. No one is suffering with the lower respiratory or the lung involvement. And that is a great achievement. And that to the extent to which that we are able to do that is a very, very great phenomena. That thanks to the government of India for giving it free of cost to the people, and entire the healthcare workers who has taken it in a great task, and to the nook and corner, even to the extent of climbing the mountain, crossing the river, they were able to vaccinate such a 2 billion people. And that is a great achievement for the modern medicine. I think today we, as a modern medical fraternity, we are extremely happy that with the dedicated work of modern medical professionals, we are able to save our country from the COVID disaster at this moment.
Right. So I also want to talk a little about, the younger population, because the kind of figures that we're seeing in teenagers with respect to vaccination are not, very great. There is, we're not seeing much traction here. Dr. NN Mathur, what do you think is the reason why we're seeing such low figures?
So the low figures are because the vaccination in children came later. So the vaccination had been going on since January 2021. But the children were added slowly because there is a process. You can't start giving first to the children. So especially the children below a certain age group, below the 13 age group now, have been included now with some other vaccine, with a special vaccine. So that's why you find the numbers of children less. Having said that, also there is that in children the disease had been mild, so the vaccine had to be first tested on adults. So both the factors combined together put the children figure less, but that doesn't mean that they are at any way at a greater risk of acquiring the disease in a severe form.
So what you're saying is that the fact that, the numbers are less in children, do you think that we have to do a little more in terms of, getting their attention? Does the government need to do a little more in terms of, making some sort of, let's call it an awareness drive, let's call it, more measures so that we should step up this number?
Yes, that process is already on. And as far as the awareness is concerned, fortunately, because of the media as well as other measures, the awareness is there. How it can further be stepped up. But children were last to be targeted. This was intentional, and it was all over the world. It had been like this. If the number is less right now, it doesn't mean that the awareness is less. It just means that the system has taken into account first the adult population, and now they will focus on to the children also.
Dr. Jayalal, I'd like to ask you now that, the fact that our vaccination numbers are good and we're not seeing many cases, and the government, of course, keeps saying that we have to keep maintaining the precautionary, measures have to be taken, wear your mask, sanitize, maintain social distancing. But to what extent do you think we're still out of the woods when it comes to the pandemic, or is there a need now still to, watch our backs? I think you're on mute. You'll have to unmute yourself.
Am I audible?
Yes, sir. I can hear you.
Yeah, at any point of time, we should not offload our guarding against the COVID, because it is a dreaded virus. It can continues to be the epidemic in our area. Though the vaccination is good, the social distancing and masking and the common places are still mandatory. And I'm sure that we have reached the stage of herd immunity. That is, more than 80% of our population has been immunized, both by the natural and by vaccination. So we are definitely, away from the risk. But still, we will be requesting the people to avoid still the mass gathering, keep a social distance, and as much as possible, when you are coming for the crowd, wear the mask. And definitely, that will save our country from the disastrous effect on the way.
Right. Both of you, Dr. Jayalal as well as Dr. Mathur, thank you so much for making time and speaking to us here on Mirror Now.